Jen from Peak Bodywork again. So now we're talking about the TFL, the tensor fascia lata. This is a little muscle that sits right in the frontish aspect of the hip. Its main purpose is to tense up the fascia, that's the connective tissue saran wrap that surrounds the thigh, and specifically going into that IT band. That's just a thickening of that whole baggie of fascia that surrounds the thigh. And what this muscle happens to also do is it's a weak hip flexor. So if your hip flexors aren't quite working right, or you're somebody who hangs out in a sway back position where you're just jamming the joint into the front of the hip capsule, the front of that joint capsule, this area can get really irritated. It can have a lot of trigger points. It can be just really tender for a lot of folks. So a method that I've found that works great is using a foam roller. So we want to be the ASIS, this bumpy part at the pockets of your pants. We want to find that spot, and then you're going to lay down on the roller with the ASIS just barely in contact with the top of the roller. Leg is straight, and you can have your other leg out to the side just for a little bit of balance. And remember, anytime we're hanging out here in this kind of plank, side plank position, we want to keep the abs strong, we want to keep the glutes a little bit engaged so we're not hanging out like a broken cow. We want to keep the spine, the pelvis in a neutral position. So now from here, we're just going to work on this TFL. It's really tender for the majority of people. We're not just getting the TFL, we're also getting into some of the attachments for the quadricep muscle group. We're getting into sartorius a little bit. We might even be getting into some of the deeper hip flexors, that psoas iliacus attachment. We're just rocking back and forth here, making little movements, thinking about having your belly button kind of 45-degree angle to the floor, and then maybe coming out 90 degrees, pointing the belly button at the wall. Working back and forth. When you find a spot that's really tender, you can either tense up the entire quad, because that will engage this muscle, holding for 5 seconds, relax and sink. If that feels a little awkward to you, you can also press your knee into the floor so you're resisting hip flexion, and then you can relax and sink it. And that's kind of the easier modification if this is a really tender area. And we're just working back and forth, rocking entire body as a unit over this spot. Taller people will obviously need to work a little bit more towards their knee as they go, just to cover the entire length of the TFL. But this is a really superficial muscle. It sits really close to the skin, so it doesn't take a whole lot of time to get these trigger points to release. It actually is really quick muscle to hammer out some of this pain in the front of the hip that you might be feeling, some of the restriction here. Kind of like to bend the knee and go into internal and external rotation with the hip as well, while I'm going my entire body back and forth. It seems to just capture some more of the muscle fibers, get a little bit more effective for me. So play around, see what works for you, and hopefully your hips are going to be feeling a little bit more open after this one. Take care.